Good afternoon and welcome back to Track 2, Legislative and Medical Advocacy. And thank you to Pfizer for sponsoring the afternoon's lunch. I am Melissa Hogan and I will be your last room mom host for the day. As a reminder, I would like to welcome those of you joining remotely through the live stream, and remember to download the mobile app to use some of our highlighted features, especially the live Q&A at the end. So for our first session this afternoon, we are joined by Max Bronstein. We've got Stein and Steen up here. Max Bronstein, Senior Director of Health Policy and Corporate Affairs at Audentes Therapeutics. Todd Bledsoe, Associate Director of the Movement Disorder Advocacy Development at Teva Pharmaceuticals. Jennifer Bernstein, Executive Vice President at Horizon Government Affairs. And Lisa Schill, Development Consultant for the Every Life Foundation for Rare Diseases. Today, they will be providing an update on federal legislation. Welcome.
Thanks very much, Room Mom. I guess, is that what we're calling you now? Thank you guys for having me, and thanks to everyone who's here today. Happy Friday, by the way. Really happy to be back here at Global Genes, and very excited to be presenting again. I think, as you guys heard, we have a really nice panel lined up today, and we're going to be talking a little bit about advocacy at the federal level, state level, and really how we can leverage public policy to save and improve lives. So with that, I want to get started. How many of you have heard of Audentes before? I'm just curious. Okay, so some of you have. For those who are not familiar with the company, we're a clinical stage rare disease gene therapy company. If you guys have gone to the talks that have gone on today and yesterday, you're probably getting more familiar with gene therapy and kind of how the technology works. But if you want to learn more about it, I have a nice little cartoon up there. I don't have time to go into all of our different clinical programs. I do want to mention our lead program is for X-linked myotubular myopathy. And we're hoping to be in the clinic with this program by the end of the year. If you guys have other questions about these programs, always happy to talk with you. Or I see Kim Trant is here as well from our team. Kim, can you just raise your hand? So if you guys have questions, feel free to run them by myself or Kim. So on to today's topic. Really what I want to talk about is something called the innovation gap, which if you guys have been paying attention at this conference, you're probably aware of the fact that we're actually getting better in some ways at detecting and diagnosing rare diseases. The problem is that we are discovering hundreds of new rare diseases per year, and we really have a lot of catch up to do on the therapeutics side, meaning we only have about 500 FDA approved treatments for rare diseases, 7,000 or more known rare diseases, and hundreds more coming up every year. So that's what I mean when I'm talking about the innovation gap. So really what we need to figure out is how to bridge that divide and ultimately get these diseases from the point where we're detecting them and diagnosing them and doing that through sequencing to the point where we're actually getting patients into the clinic and actually commencing clinical trials so that ideally we can get an FDA approved product out there for patients. So what I want us to think about today in the context of this panel is what tools can we leverage to accelerate this drug development process and ideally bridge this innovation gap that we all care about. So one of the ways we can do that is through public policy. And that's really what the focus of today's panel is going to be. Now, there's lots of ways we can work on public policy. There's legislation, there's regulation, there's rulemaking. If you think about some of the agencies in front of you here, for example, I think you guys are all aware that NIH is the largest funder of biomedical research in the world, obviously very critical and important part of the rare disease community. And then every year, Congress has to make decisions about how to fund the NIH. What level does the overall agency get? How do the individual institutes and centers get funded there? And all of those decisions are actually opportunities for advocacy and opportunities for patients and advocates to weigh in. And then, of course, once you get something through the clinical process, you hopefully want to go to the FDA next and ideally get something approved. So there's all kinds of opportunities to weigh in with FDA on patient engagement, on inputs around the drug development process, lots of opportunities there. And then when something gets approved, ideally, Then you have to start thinking about the reimbursement side of things, really working with public and private payers to ensure that patients are able to access the drug or whatever is kind of coming out in the newest thing. So all of those are kind of some of the work you can do with agencies. There's also a legislative aspect too, which Lisa's going to talk about, 21st Century Cures, so I won't go into deep detail there, but it's an example of something that's had a big impact for patients on the legislative front. And then we can think about the sort of state side too, and the newborn screening program is something that has been hugely impactful for patients, and every state in the country has its own newborn screening program, but there's lots of opportunities for advocacy there because of the fact that all these different states are actually screening for different sets of diseases. So definitely have a lot of work to do on that front, but all of those are examples of places you can get involved and get engaged. But I'm not going to kind of sugarcoat it for you guys. Advocacy is extremely challenging at times. It's not a cakewalk. It's more of a marathon, definitely not a sprint, I would say. And there's a variety of challenges, and they're always going to be different based on the political environment. And today, I would say we are definitely in a hyper-partisan political environment, for better or for worse. And when I talk about partisanship, it's not just between the two parties, it's also within the parties too. So it's a very kind of tricky dynamic right now, but those are all things that can be navigated. Another issue that is inevitably going to come up with public policy is how to finance new programs. You know, if you want to expand newborn screening, or if you want to initiate a new federal grant program, obviously all of those are going to cost money. So you have to think about, you know, how do you pay for those programs, and who's going to be concerned about those programs coming about and how much they're going to cost. So all those are things you need to think about. And the other kind of interesting thing about advocacy is, as you get more successful, you're going to get a lot of supporters along the way for your idea, your advocacy initiative, but you're also going to get detractors too. So when you start getting those detractors, that's actually a sign that you're on the right track. It means, you know, they're taking you very seriously. What you're proposing has the potential to become a law, regulation, or reality. So don't be discouraged when that happens. It actually means you're doing something right, most likely. And so the great thing about disease advocacy, and this is especially true with rare diseases, is it can totally overpower those challenges that I talked about. Those challenges are not going to go away, but with disease advocacy, effective disease advocacy, you can actually make a huge impact for patients. So I think everyone is probably aware of the Orphan Drug Act. Is everyone aware of it? Okay. Everyone has heard of the Orphan Drug Act. I think it was really transformational in launching orphan drug industry. We would definitely not be where we are today were it not for the Orphan Drug Act, so that's a great example of what we can accomplish when we kind of work together as a community. I want to provide a more recent example here. This is something called the Best Pharmaceuticals for Children Act. This is the impact that you're seeing. So for a long time, we had hundreds of approved drugs that were pretty well tested in adult populations, but had very little data about how safe and effective they were in pediatric indications. So BPCA actually created an incentive for companies to study these drugs in kids, and resulted in hundreds of labeling changes, which meant for the first time we had really good data sets around what drugs were safe and effective for use in kids. And then one more very quick example I want to touch on is the 21st Century Cures Act, which, just raise your hand if you've heard of this before. That's amazing. So you guys are in the right room. Lisa, maybe, yeah. Okay. So yeah, Lisa's going to be going into more detail about 21st Century Cures, but it's really an incredible story, and rare disease patients were front and center for making that possible. So those are, you know, some of the examples of what we can do together as a community. So, you know, just to wrap up, this is a very high-level overview, but you're definitely going to run into challenges in advocacy, but because of the fact that you guys tell really compelling, powerful, and human stories, that's going to help you overcome a lot of those challenges, and it will totally bridge that partisan divide I mentioned earlier. So that's where, our power comes from as a community, is really from the patients and the patient voice, because I think at the end of the day, everyone can identify with what it's like to have, to be facing sickness, to have a sick kid or a dying kid. Everyone identifies with that and understands why it's important to do something, either in a policy sense or a regulatory sense, to improve the world and ultimately get to a place where we can think about eliminating all disease. I think everyone can identify with that idea. So really what we should be thinking about in our community is thinking about policies that are not only pro-patient, but also pro-innovation. And I think innovation really is a top priority, because I know many of you are still waiting for that FDA-approved therapy. So just out of curiosity, how many of you are still waiting for an FDA-approved therapy for your disease? Right, so this is exactly why innovation needs to remain a top priority for our community, because ideally, I want to come back here in 5 years and ask that same question, and I want to see everyone be able to raise their hand and say that they have an FDA-approved therapy or something approved in Europe. So with that, I want to wrap up and turn it over to our next speaker, Todd. We're going to be doing questions at the end, so please save it for then. Thanks.
Thank you, Max. I think Max did a great job of really highlighting the why we do what we do as it relates to legislative advocacy and political advocacy. So I'm going to spend just a few minutes here really talking about the how we do that, especially as it relates to engaging members of Congress or federal policymakers as well. But before I dive in, just to be fully transparent, everything I'm going to share with you today is really based on my own personal observations of having sort of dealt with the politics of pills for the better part of 20 years. It's not necessarily reflective of the opinions of my employer. But we are here, if you're in this session, you've probably got a little bit of an interest in politics. So we'll have a little crowd participation here. Does anyone recognize this person? Yeah, indeed. So you may recall, in 1992, James Stockdale ran for vice president and with Ross Perot, and we thought things were sort of odd back then. But I remember watching the 92 vice presidential debate, and Admiral Stockdale is up there literally between then Vice President Quayle, Senator Al Gore at the time, and he asks this question. He said, well, who am I and why am I here? And I feel a little bit like that with these great panelists that you've got here. But I'm really here for a couple of reasons today. One, as a family member of someone who lives with a rare condition. But then secondly, while I've had the opportunity to be in the life sciences industry for the better part of 15 years, prior to that, I really started my career in the public sector and had the opportunity and the privilege of working at the White House in the late 90s. And toward the end of the administration, I moved back to my home state of Kentucky and worked in the governor's office there as the deputy chief of staff. And so I've been on the other side of the desk, is my point in that. And I can recall time and time again, organizations, health advocates, economic development advocates, organizations representing a whole variety of causes would come in. And you can see pretty quickly when you're on that side of the desk, those organizations that have the capacity and the bandwidth to advance their cause. Sadly, I've seen more than one public policy debate go awry, not because an organization didn't have the right argument, but simply because they were outmaneuvered. So I want to spend a little bit of time talking tactically about what some of those visits will look like when you storm the Capitol or when you're storming your state house. And so as I think about engaging legislative advocates or in the legislative process, we often talk about the sausage being made as it relates to legislative business, and some people frown upon that. I frankly love it. I don't know what that says about me, but I will say this: as advocates, we all have passion, right? Because if you didn't have passion, you wouldn't be here. But with all due respect, I think that passion in and of itself simply isn't enough anymore. Years ago, it probably was. But now, because of the increased complexity of a lot of other issues, passion in and of itself will not carry the ball forward. So I've got a hypothesis, which you can agree with or not, that passion combined with facts and data really will help us advance the cause and really help the appropriate kind of sausage being made. And so when you get together and when you plan with your colleagues and other members of your organization, a Hill visit or again meeting with state lawmakers as well. I kind of think of things in buckets, right? And so we've got some homework to do on the front end during that visit, and then even afterwards. But at the end of the day, you have to know who you're going to be talking to, right? And so just out of curiosity, how many people have maybe gone to either their state house or Washington, D.C. for a fly-in or something? So we've got, yeah, maybe a third or so, something like that. So for those of you who haven't, don't at all be surprised that when that opportunity comes up, when you've got a meeting with X member of Congress, don't be disappointed if you're not actually meeting with that member of Congress, right? Chances are really good you're going to meet with someone who looks about 22, 24 years old, and that's okay. It really is okay, because one of the worst kept secrets in D.C. is a lot of work gets done at a staff level, and most of these people are incredibly bright. And they could work a lot less and probably make a whole lot more money doing something else. And so know who you're going to be sitting down with. But also, because we live in such an era of transparency, it's pretty simple in this day and age to know where a particular lawmaker may fall out on those issues. And so I would encourage you to take a look at their public statements, their press releases, their speeches, newsletters, et cetera. You can find a lot of information from their voting records, which are very easy to find, or easier to find at the federal level than they are at a state level. And Max touched on this. As you advance and as you move forward, you will have your detractors. And I would encourage you not only to acknowledge that, but also be prepared to mitigate that. Having been on, again, the other side of the desk, oftentimes you will ask the question, well, who is going to be opposed to XYZ, right? Now, sometimes, not all the time, and sometimes there will be truly non-controversial issues. There aren't many of those, especially in healthcare policy. And so I think for the credibility of us as advocates, it's important that we not only acknowledge that, but then also have your game plan in place in terms of how you're going to counter against that. And finally, before you go in, define success. Know what good is going to look like. And we'll touch a little bit on that later on once you actually get to that visit. And so I love to do things in threes. You can probably tell that. So I say, you know, there are 3 Bs. Be brief, be brilliant, and be gone, because people have got other things to do, right? But especially in D.C., it's not uncommon to have a 10-minute, 15-minute meeting. It might be a 2-minute or 5-minute pull-aside meeting in the hallway, and that's okay. You're going to be grateful for whatever time you're given. And so it was always fascinating to me, more so when I was in the governor's office. We'd typically give people a 30-minute meeting. And again, you always want to exchange the pleasantries. You want to make that connection early on. But that doesn't mean you have to spend 20 minutes in small talk, right? Because the clock is ticking. And so I prescribe to the notion that less is more, right? 1-pagers, 2-pagers. Most people don't read 200 and 300-page reports. And so it's, I think, underscores the importance of just taking that information in a way that's easy to absorb. And so in that meeting, you know, I use the phrase connect with credibility, and especially if you're meeting with your member of Congress or a member of the Senate, it's important so that they know where you're from, what common areas of interest or mutual interest that you might have. But then you can move on and really tell your story. And as advocates and as family members and as care partners, that's something that no one can take away. And I think that that's where we have that opportunity to connect, again, with the facts and the passion. I do want to highlight, though, I think one of the most critical aspects of a visit like that really is making the ask. And it astounds me, of having seen this over a period of years now, the number of organizations that will come in, that will walk away from a meeting thinking that they had a good meeting, and the staffer or even the member of Congress or the principal thinks that it was a nice meeting, but they didn't ask for anything. And so I think that that's where you have that opportunity to, because you've already defined success on the front end, you've got to land the plane. And whether that's asking them to sign on as a co-sponsor, whether it's to vote yay or vote nay, whatever it is, whatever that ask is, make sure that that's clear. And then finally move on to something else, because chances are really good that they've got something else that they're pondering as well. And I can recognize that sometimes there may be areas of disagreement, and that's okay. But I suspect that if we dig deep enough, we can probably find an area where we can agree. And so I would encourage all of you to simply end on a positive note when you have those meetings. So afterwards, follow-up really is key. It's interesting because while the visit, the in-office visit, it is important, the real work begins after that. And so sometimes it's the simple manners of life. Please and thank you can take you a long way, right? Especially if you're meeting with a member of Congress or someone on the Hill. While I'm a huge fan of handwritten notes, the way in which mail is delivered to Capitol Hill, sometimes there's a significant delay, so you may have to pop an email, and that's okay. But the point is, it gives you an opportunity to have a second touch with the people that you met with. Certainly not every question or not every topic gets discussed in that meeting, and so that's where you've got the opportunity to provide additional follow-up as well. But I would also encourage you to invite that stakeholder, that policymaker to your next event, and not just for a tour, and tours are great, but politicians like to see people, and they like to be seen by people. And so whether that's your walk or a gala or what have you, my experience has been they don't tend to lack for things to go to, and having the opportunity to have some visibility with constituents is probably a good thing. I'd also say to thoughtfully consider posting about the meeting through social media channels. Sometimes that will be appropriate. Sometimes it may not be appropriate. And so it's something that each of you and your organizations would just have to consider on the back end of that. And so finally, just to wrap up here, as I think about the work that we do as advocates, especially in the rare disease space, I love this quote that you see there, we may be rare, but we've got roar. And the reality is black lions are pretty rare. But I think by engaging and investing time and resources in events just like this, the work that we're doing throughout the course of the year, it really does help strengthen and enhance our own capacity, and hopefully will help each of you strengthen your own voice as you move the ball forward. So I appreciate the opportunity to visit with you. I'm going to turn it over to Jen as well to talk some more about what's going on in Washington.
This is very wobbly. It's I'll try not to. Hi, everyone. A little disclaimer from me as well. I'm here representing Horizon Government Affairs, but to be perfectly honest, I am the mom of a daughter with a rare disease, so I'm going to be a little snarky and maybe a little more honest in my remarks than I would be if I were just representing Horizon. So I apologize in advance. I'll try not to offend anybody. I like to start every presentation with a political cartoon. I don't really know what to say about Congress right now. It's a mess. My job is to work with Congress, and I will be honest, it's very difficult right now. We have a lot of policies that we'd like to pursue, and there's no way to move them. And you can go and talk to members all you want about why what you're working on is a good idea, and they will agree with you. But at the end of the day, if they're not going to work with each other to move policy, you can't really move your policy. So I start with this, which goes into my next slide. Everybody hates everybody. This is sort of just a further illustration of why things are not getting done. These are actually Gallup numbers, and that's not even from this week, so these numbers are actually probably worse than they were when I did the slides. But the president's approval rating actually looks really good compared to what the congressional approval rating is. And as Max was saying, it's not even just, both sides disliking each other. It's, factions within each party. It's really hard to get anything done when everybody hates everybody and nobody wants to work together. And so there have been some success stories, but I really feel like, our issues are nonpartisan. They're totally purple, and yet they can't help but be caught up in this everybody hates everybody space because our issues are difficult to move right now, at least in Congress. But I have a solution, which I will get to in a few slides. I just want to update everybody on health reform. A lot of people have actually asked me about it. I figured I'll give you what I know right now. Which will probably change tomorrow. But as of right now, the House and the Senate have both abandoned a broad repeal and replace package. I think they see that's not going to go anywhere. So they are trying to put together these piecemeal packages which are actually different in each chamber. And so you have the House wanting to repeal the individual mandate. You have the Senate wanting to set up, well, some people in the Senate wanting to set up a stabilization fund to keep the markets more financially stabilized so that they don't completely disintegrate. But you can't repeal the individual mandate and then try to stabilize the marketplace. Like, it's crazy. They're just not talking to each other. And so there's some other things going on. The IRS has said they're not really enforcing the mandate that you all have health insurance. So even though the mandate is still there, they're kind of ignoring it right now. So it's a mess. And so there are some smaller scale bills that some members, particularly in the Senate, are talking about moving. I don't think as of right now that they will gain a lot of traction, but this has sort of been a very fluid process, so don't hold me to this if in a month we're talking about something else. But as of right now, we've spent an awful lot of time fighting on this issue and we've made no progress, and it's very frustrating, but that's kind of how things have been lately. I do want to flag Medicaid reform for everybody because there's a chance that this might happen this year in some capacity, and I do think that this impacts a lot of people in the room. A lot of people were focused on health reform and thinking that once that didn't go anywhere, that Medicaid reform was dead, and I'm telling you that it's not. There are a lot of conversations going on, particularly within Senate leadership, Republican leadership, about Medicaid reform. So I don't want you to focus too much on this right now, but I do want you to be aware that there are some tricky things that might happen with waivers. And so it's a really fancy way of saying that states might be allowed to opt out of offering certain benefits, or they might be allowed to require more from you as a beneficiary in terms of how many hours you're supposed to work or what your income levels are. And so there's not agreement quite yet on how to move forward with this, but there is some pretty strong will within Senate Republican leadership to do something with Medicaid. It does not have to be tied to health reform. So don't think that you're out of the clear just because this broad health reform package didn't pass. So I just want everybody to keep an eye on that. There's nothing to engage on right now, but RDLA, Rare Disease Legislative Advocates, will obviously be posting updates on this, as I'm sure many other patient groups will. So just keep an eye out for that. The Rare Disease Congressional Caucus is a tool on the Hill for you to engage. The membership list is available at Rare Disease Congressional or rarecaucus.org. I didn't put the website on there. Google it. But there's a ton of members, and actually within the last couple of weeks, the caucus has grown. I mean, we've added like 10 members in the last 2 weeks. And so what I suggest to you is if you really want to be engaged on the Hill, take a look at the caucus membership and see, first of all, if your member is not on the caucus, ask them to join. But I would target the members who are on that caucus, specifically the co-chairs, and I will say that Congressman Lance and Senator Hatch have been amazing, not to throw shade at the other two, but Lance and Hatch have been extremely active in the caucus, and their offices and their staff are very receptive. So if you are looking to engage on the Hill, the caucus is a great tool for you to use. The members of that caucus are already aware and engaged on a lot of the issues that impact the community, so it's a good starting point to begin there. I have found, though, that this year my focus is actually less on the legislative side of things because, like I said, I feel like I'd be more productive if I just bang my head into a wall for like 8 hours a day. So I don't want to do that. But what I have found that this year in particular, I'm way more focused on the regulatory side than I have been. I mean, my background is clearly legislative. I worked on the Hill. That's sort of my focus. I'm a policy wonk. But it's very hard to get things done in that space. Oddly enough, an easier path forward a lot of times is to work directly with the FDA. And I probably would not have said that a year ago, but the current FDA commissioner is amazing and very interested in being active and engaged, unlike previous commissioners who I couldn't really tell you what they did. Scott is very motivated to improve and modernize the agency. And so he is also very familiar with rare diseases, and I think that there's a big push internally at the agency to create an environment that is better for all of us. And so there are a lot of opportunities for you to engage directly with the agency. I talk to a lot of people who I see their eyes glaze over when I talk about regulatory, and they just think red tape, it's a total burden. And yes, that's true. But there are some public meetings that are coming up that are open to the public. A lot of these meetings are webcast, so you don't have to be in DC to attend them. And I would suggest signing up for the Federal Register notices. You can actually sign up by keywords, and then the Register will email you every day articles or entries into the register that contain your keyword. So if you just go to the Federal Register, enter in the keyword FDA, you'll get an email every day with anything that contains the words FDA. And so a lot of these public meetings will just be emailed to you, or you can also go to the FDA website and search the public meetings, but I think it's just easier to have the stuff emailed to you. So there is a workshop coming up on patient-focused drug development at the end of October. They're going to be having a public workshop, another one this year, on how to collect patient experience data, which is a hot issue right now, and the agency is just trying to figure out the best path forward to collect that data from everybody throughout the drug development process. Now, the agency is required to publish draft guidance on this by next year. So these meetings now are to aid in the development of that guidance. And if you don't participate, you really shouldn't be allowed to complain about it. So get active, sign up to attend these meetings or watch the webinars. They're free. There's going to be more of them. And I really feel like it's better for our community right now to focus more on engaging directly with FDA than perhaps we have in the past. If you have any questions, please feel free to email me. I'm in DC, but I'm happy to answer anything related to or unrelated to DC. We talk about the Cubs, we talk about the Bears, we talk about rare diseases, whatever. But I'm always available, and so if you need anything, please don't hesitate to reach out, and then I will answer questions after Lisa's presentation. Thank you.
Hi, my name is Lisa Schill, and I do work for the Every Life Foundation. That's one of my hats. But my other hat is working for the Restopathies Network, which is what I'm going to be talking about today. But without Every Life, I would have never learned all this information. So I'm here today to talk about on our path to cures. My third son was born. When he was born, he was rushed to the NICU, and we weren't sure what was wrong. And it would take 1.5 years to get the diagnosis of Noonan syndrome, which I thought was a really long time. But then I learned that it takes on average 7 to 8 years to get diagnosed with a rare disease. And my son was diagnosed with Noonan syndrome, which is a genetic disease that runs on the RAS-MAPK pathway, and it's one of the restopathies. And it does not have a treatment. So as any mom would do, you want to find that Band-Aid, right, to help solve all of these problems. So I got involved with the organization, the Restopathies Network. And our mission is to advance research of the restopathies by bringing together families, clinicians, and scientists. But how do we get to a cure when you really start to think about it? What can I do? And I learned that it takes 11 to 14 years to develop a new treatment and up to $2.6 billion. And that's a lot of bake sales. So I knew I couldn't raise that kind of funding. I know some people can, but that wasn't me because I didn't want to make that many donuts. So I decided that I wanted to work on policy. And I wanted to drive legislation to create and change and cure the process. But I wasn't exactly sure how to do it, even though I knew I wanted to do it. So I attended my first RDLA, Every Life, Rare Disease Week on Capitol Hill. And I learned about the 21st Century Cures Initiative. And it all started with Congressman Upton and two little princesses that had SMA. He was getting a lot of rare disease patients coming to see him complaining about the same thing. 95% of rare diseases don't have treatments. And what can we do to get more cures and treatments? So he started this initiative, but he's a legislator, right? So how much does he really know about getting to treatments and cures? So he was in charge of the Energy and Commerce Committee and decided to set up a website to ask for draft guidance on what should be included in this bill from patients, from academia, from researchers, from industry, all the stakeholders. So at the conference, I learned that they were accepting draft guidance, so I wrote some in the middle of the night. I know I talked about funding for the FDA and NIH and also patient-focused drug development, but I really never thought anything would come of it. But I did. I got phone calls and emails from the committee asking more questions and to come in for a meeting. And I also helped set up a roundtable in New Jersey, where I live, with other rare disease advocates to bring all the stakeholders together to also talk about how we could create this draft guidance. And this was happening all around the country, thanks to Congressman Lance for helping us get that together. So what was in this 21st Century Cures when it finally became legislation? It was a 400-page bill, and yes, I did read it all, but I don't remember it all. And so it didn't just include rare disease, but to help the rare disease population, it was improve biomarker qualification, improve FDA's ability to recruit and retain staff and keep up on the latest science, because a big problem is having people who work at the FDA who don't understand our rare diseases, and they're making decisions on our behalf if a drug should be, come to market. Billions in the NIH and hundreds of millions in FDA funding, the expanding HOPE Act priority review vouchers, Neurological Disease Surveillance, Compassionate Use Reform and Enhancement Act, and patient-focused drug development. And I was really impressed by this. I was like, this is how democracy works. I guess I forgot to mention that Congressman Upton decided not to just do this by himself as a Republican, but also to partner with Congresswoman DeGette, Diana DeGette from Colorado, to create this legislation, because they wanted it to be truly bipartisan. So I was working on getting more people in my family to call and to ask for support of this bill. And my kids were always like, why are you on the computer? Come play with me. What are you doing? So I explained a little bit about what we were doing. And my son Max started making drawings. And my other son Reed wrote letters. Another provision of 21st Century Cures was the Open Act that didn't pass. It was for repurposing drugs. But one of my favorite letters, you can't really read it there, my son Reed wrote 3 reasons why you should pass it. And if he's like, you don't need to know the reasons why you shouldn't. So, but we posted them on social media, and Energy and Commerce saw them and invited Max to share his story and also blow up his pictures to use at the hearing. So it started on the committee, and Max was invited for the committee vote, which was 51-0, which is kind of amazing that 51 people out of, 54? Because I think there are a few that weren't there, said yes. And I'm not a crier, but I actually cried when there were all those yays. And Max actually should be 52, because Max said the last yay. And then we were so impressed, we decided to make thank you notes for all the members and deliver them to each of the office to say thank you. Thank you for caring about rare disease patients. Thank you for working in a bipartisan effort to get this across the finish line to help so many people. And then it went to the floor, on the floor for the floor vote. And Max actually got to go on the floor. I didn't, so I was a little worried what they were doing with him. He got to vote for a lot of members, but he didn't set anything on fire or anything, so I was like, yay. And so it passed 344 to 77. And then it was onto the Senate, and we thought we saw the light at the end of the tunnel. We're like, yes, this flew through the House, so we're going on to the Senate, and we're gonna get there. A year later, crickets. Nothing's happening, So I just, we were kind of amazed, it's going so well. And, there's all these other problems in the world, but we don't see them because we only see rare disease. So, we don't realize that the government's working on all these other things. So you have to constantly remind them, hey, we're still here and we still need your help. So I asked Max what he wanted to do about it. He's like, let's make pictures and take them to all the Senate offices. So he drew 100 pictures, and he had 2 days to deliver them. And I was thinking, because he doesn't like to walk. So I was thinking, oh yeah, we'll make it to 2 offices or 3 offices, and then he's gonna be done. So, but I didn't realize on the Senate side, it's like trick-or-treating. So every office has lots of goodies, and they also have all these fun dead animals on the wall. So, it ended up that we made it to 84 offices in 2 days. He wanted to finish the next day, but I was like, no, you have to get back to school. So we had a friend deliver the rest of them. So, and one of his favorite offices is Senator Toomey's office, because he's the candy man of the Senate, and he's kept that role. So if you're ever on the Senate side and you need a little sugar, go to Senator Toomey. But it wasn't just about us, and I think that is really crucial and important to understand. It takes a village. It takes everybody to make those phone calls, to write those letters, your friends, your family, your sorority, other people in the rare disease community. So it wasn't just Max and I. It was our village. And Elizabeth Parker, who's back in the corner over there, she wrote this wonderful, wonderful little blurb on social media asking for help, and 13,000 people liked it, and 300 people took action, calling their members. And Frank, who's also in the audience over here, he had a Rare Disease Day in New York and does a lot with making sure that people call in and learn about policy. And Sharon, she made these beautiful things on Facebook. She actually got kicked off of Facebook for a little bit because she posted too much about it. And then Sharon and Emily, who are just teenagers, not just teenagers because they're absolutely amazing, started a cyber cures rally to get people involved. So it really takes all of us working together to move the needle that's going to help all of us and get us all treatments and cures. So Max was invited to the enrollment ceremony and asked to speak. And this is where they signed the bill to send it to the president. So they got him a little stool to stand on. And, he just basically said, cheers to cures. He was so excited that, we finally got it to the finish line. And it wouldn't have been out without all the hard work of Congresswoman DeGette and Congressman Upton for never giving up. Even when it got really rough, they kept it going, kept the needle moving. And 21st Century Cures became a law. Max got to keep the pen. He was very excited one day to try to use it to compare it to a space pen he had. And I was like, oh no, maybe we shouldn't be playing with that pen, honey. And then he was able to see the president and meet the president and see him sign it into law. And here he is at the signing. And he actually got a school note signed by President Obama and Vice President Biden, excusing him for all of the time he spent lobbying over the last 3 years. So that was great. We still have the letter framed. And we also have some really nice pictures of him and Obama, but Obama's photographer took them, and I'm not allowed to share them publicly. So, but they're great. We have them. But it wouldn't have been done. I know you mentioned the staffers. We created really close relationships with a lot of different staffers, and if it wasn't for them and all of their hard work, like you have no idea. They go in at 6 in the morning, they're there till 11 at night working on these issues and working for you. So, never roll your eyes if you're meeting with one of them or to the secretary, because they're very helpful. But there's still more work to be done. I mean, when we signed the bill, Max said to me, so mommy, does this mean I'm cured? Which is really hard, and at the enrollment ceremony, we actually left the enrollment ceremony, and he went to hold his friend's hand, who was just diagnosed with a bleeding disorder. So he took off his tie and buttoned his shirt, and because he's had infusions before for his bleeding disorder, he held her hand during it, and it just reminded you that there's still so much more work to be done. So the key takeaways are create relationships with members and their staff. Remember, it takes time to develop relationships. You didn't just meet your husband or your wife in one day, and it takes months and time getting to know them and reaching out to them. And don't choose sides. Rare disease affects Republicans, Democrats, and liberals. And call, email, and meet with your members and their staff. Have your friends and family reach out as well. It's very easy for them to do. They might not be able to give money to disease, but I think that your great grandma can make a phone call. I bet she'd really like to have someone to talk to during the day. And then anyone can change policy, whether if you're 5 or 105, we can all do our part. And the more that we all collaborate together, the more our voices will be heard. And if Max was here, because the one thing he was disappointed of is the Open Act was not included in 21st Century Cures, he would say, please help him open the doors to more treatments, since 90% of patients take drugs off label, to help repurpose drugs for rare diseases and help pass the Open Act. And then another thing we're working on, like Jennifer said, is implementing cures now. And there's going to be these 4 meetings with the FDA, plus the one with Global Genes on October 30th that you can become involved with, as well as getting funding for the provisions in 21st Century Cures. So thank you so much.
So I have to say, I am friends with Lisa, and I knew a lot of her involvement with 21st Century Cures, but I'd never heard the full story. And I don't know about y'all, but I think she needs another hand because that's just incredible. So we're open now. We have about 15 minutes for questions, and I'm also looking at questions possibly from the live stream, or if you can submit them through the app as well. But if you want to, just raise your hand.
Hi, my daughter has thank you for your candor, by the way. Love that. My daughter has an ultra rare genetic mutation, and ironically, the specific drug is one that a lot of us are very familiar with, CBD. It's the only thing that has actually helped with her movement disorder. We have tried at least a dozen approved medications which have devastated her. And it's the one thing, I mean, she literally went from walking 10 feet in 20 minutes struggling to 150 feet in under 5 minutes. She now, her voice, you can hear her across the room. I mean, there's amazing documented things that I documented myself. My question to you is, of course, I have a medical, I'm under a doctor's care for the dosage because I want to make sure I did it right, but I can't leave California. We can only travel within California. My goddaughter's graduating from Nashville, next year, and I didn't even realize the fact. I knew that technically I'm not supposed to cross state lines and this and that, but then I came also to discover, I thought with a medical card, okay, shouldn't be a problem. Can't even get on an airplane because it's federally regulated. In that circumstance, what do you think the best course of action would be? Like, should I bring her with me to my congressman's? And I have written letters, by the way. But where could I go now from this point to try to get it to become federally approved, especially if you have that medical card? Because, I mean, it's the only thing that works for her.
Okay.
It's rough.
Yeah, it's complicated. This might take the better part of 15 minutes. First of all, let me say a couple of different things. One, I mean, it sounds like you've done your homework, right, on the front end, and you know what those parameters are and what they are not. I do think at a broader level, I would say this: when we engage and when we meet with members or their staffs, I tend to take a belt and suspenders approach, right? And what I mean by that is, yes, you do the DC and all of that, but more often than not, their schedule is not quite as intense back in the district or back in the state. So I think having a dual track there, and it sounds like you've already engaged with some of that as well, something to consider, and I don't know, again, the details of the California regulation, but it perhaps could be something that even other HCP organizations, not necessarily the State Medical Association, would be interested in engaging in as well. It's interesting because I've seen, more so a few years ago, I was doing some state lobbying, a lot of advocacy work, really among the epilepsy community as it relates to what you're talking about. And I think from there are other organizations, right, whether they be HCP related or even other patient advocacy organizations who may have a similar position of what you've outlined there.
Just one comment. I mean, you asked about whether you should bring your daughter to these meetings, and I think in my view the answer is absolutely, if she can. I mean, you heard Lisa's story. In my opinion, of all the things that happened for 21st Century Cures, there was literally nothing more impactful than when patients themselves came to Capitol Hill, because then they truly saw what was at stake, and that kind of opened their eyes to what it's actually like to live with a rare disease, what the challenges are like. And I mean, Max was the most effective lobbyist on Capitol Hill, and we paid him in Legos and ice cream. So, I mean, it doesn't get better than that. And obviously, it was a beautiful story, and it turned out well. And that should really be a model for how legislation should move. It should be bipartisan. It should be bicameral, and ultimately happen as quickly as possible, because obviously in the rare disease community, time is of the essence.
Not to put you on the spot, who is your member of Congress? Okay. Talk to me after. Okay.
More questions? Or I'll fill in with some questions of my own. Just raise your hand.
Hi, thanks. So I actually don't really have a question, but I just wanted to piggyback on what Jennifer said about signing up for FDA alerts. And there's actually an easier thing that I would recommend. I used to work in the FDA Office of Health and Constituent Affairs, which is one of the patient engagement offices there. And there's a newsletter for patients. So if you go to the FDA.gov website and click on For Patients, it's every 2 weeks, and I think it has a really nice summary of the ways that folks can get involved.
I'm glad I said nice things about the FDA. My husband works there. I can't really trash them.
This is also not a question, but the Everyday Foundation is offering 10 travel stipends for $500 each to the FDA meeting on rare diseases on October 30th that Jen Bernstein mentioned, and you can apply online through midnight on Sunday. It's raregiving.org. Because we want to make sure, one of the priorities of the Everyday Foundation is to make sure legislators and regulators hear directly from the people who need treatments. And so this is one of the opportunities, good opportunity also for if you represent an organization, to learn more, not only what is FDA doing, but the resources that they have available that might be of interest to you and your patient population.
So maybe while we're waiting for questions, I do want to kind of pose a challenge to you all as rare disease advocates. So if you saw in Jen Bernstein's slides, you saw we have something called a rare disease congressional caucus. And one of our co-chairs, Senator Hatch, as you also probably noticed, he's not exactly a young man anymore. And I would argue that there's probably no one in Congress who's done as much for rare diseases as Senator Hatch has. And so what we all need to be thinking about as a community is who is going to be the new Senator Hatch, because he could retire, he's definitely getting up there in age, but we need more people like Senator Hatch in order to be truly successful on Capitol Hill. So I'm going to leave you guys with that challenge. It's a big one, but when you're going to these member offices, meeting with your senators, this is something you should be keeping in mind, because this is an area I believe that the Senate can have a huge impact in, and certainly we need more people like Senator Hatch on Capitol Hill.
I'm a member of a rare disease community of adults, older adults in our case. Most patients are diagnosed in their 50s. Having gone to Washington, D.C. several times to speak with legislators about the issues of funding NIH and initiatives, 21st Century Cures Act, we pounded pavement for that as well. Lots of letters. If as a patient advocate, we have visibility of something that someone else is got working for them, but is not holistically processed through knowledge banks in government so that we can take advantage of it. And I'm not talking about proprietary information. I'm talking about open knowledge of something that works very well for patients, that's an approved medicine that has been vetted for 30 years, and it can really make significant changes for people that don't have treatments. There is an absolute unmet need for everyone in this room and everyone in the community of rare disease. There are things out there that work, but because they're all in silos, we're not effective at it. How do you suggest as advocates we can help break those silos apart?
I think I'm 0 for 2 now with holding the mic on the tough questions. I would say a couple of different things, and one, persistence really is key, right? And the reality is DC is becoming more complex, not more simple. There are more silos than there were a decade or so ago. A mentor of mine gave me some great advice years ago, completely unrelated to healthcare, but I've sort of brought it with me. And the advice was, do your little perfectly, right? And actually, Max and I were having this discussion earlier around Medicaid issues and looking at the way in which we fund Medicaid and what portions of Medicaid will look at and what things that they won't look at. But at the same time, when you think about, let's talk about a dual eligible, a person who's on Medicare and Medicaid, right? So there are a whole host of public policy challenges that come alongside that. And so when I think about the persistence that comes from the voice of the advocacy community and doing your little, whatever that little is, as perfectly and as diligently as you possibly can. Again, I mean, Max, right, did his little perfectly. And some of those silos, the system was built to have silos, right? I mean, the whole founding fathers, part of the idea of all of this was to have tension in that. So some of those things, not always, but some of those things are built in by design. But at the same time, we've all seen the mosaic, right, of how things get twisted and turned for sure. I don't know for sure.
I don't think this will necessarily solve the problem immediately, but do you participate in the RDLA monthly calls? Maybe even if it's every call, and, speak up and ask people to work with you. I feel like that's probably the easiest, most immediate way, besides social media, that you can get out there that you're willing to work with people across disease spaces. Hopefully, just continually putting yourself out there like that, you'll get people to work with you. But I understand what you mean about people being very kind of like protective of their turf, and it's frustrating. I saw it before before my daughter was diagnosed, but then you look at things a little bit differently when it impacts you directly, and I see it now differently, and it's very frustrating. But just keep putting yourself out there, and hopefully you'll get more people to want to work with you on it.
And mine won't help you, I'm sorry. This was just piggybacking on something that you said about do your little, which I love that. I'm like, that needs to be my new tagline. But I think it's true. I think it's like, when you learn in CPR class that like, you have to point out that person, you call 911, because everybody's sitting there saying, oh, that other person's, calling 911. Or this morning when we had the action alert for the rally of medical research, and I looked around and there are people like not calling, and I'm like, what the heck? And they're probably thinking, oh, this isn't that important. It's just like one phone call, but trust me. They tally all those phone calls and all those times. And you got to see the fun pictures of Max, but you didn't see all the other times, all the emails, all the calls, all of us calling our friends to educate them on the issues to make a difference over, 3 years. So make sure you do your little and don't say, oh, you know what, I have too much stuff on my plate to take that 5 minutes. Make sure you take that 5 minutes.
Hi, guys. I have a quick question. So I wanted to say thanks for your presentation. I'm in awe of what the rare disease community has been able to accomplish, especially at the federal level with a really difficult Congress with cures and even the latest round of PDUFA. But something I keep thinking about is, look, we have a new Energy and Commerce Committee chair, right? There's a bunch of new members. What's our next big idea at the federal level? And I think it's a hard question, right? Because there's so many issues, but, what's our next cures? Jen Bernstein, please answer.
Thank you, Rachel Mack. Everybody meet my friend Rachel. So I don't know what the next big thing is. That has to come from you guys. But you do bring up a really important point that I should have mentioned. So thank you. Congress is turning over all the time. It's going to be even worse in the next round of elections. There are a lot of members who have already announced that they've kind of had it and they're going to retire, and I don't blame them. That means there are a whole host of new members that are going to come in, and I always tell people at the beginning of each new legislative or new Congress, go in and meet with your member and let them know who you are. If you have a new member, they're going to have to get up to speed. We have members that will fall off of the caucus. We're going to need to replenish those members. So do your part at the beginning, after the election, start reaching out if you have a new member and get acquainted with them and help them get up to speed quickly so that we don't have to spend a lot of time in the spring getting them up to speed with things that they could have known in January. Start making the connections. I'll have all new staff. The committees will change. Everything changes every couple of years in the House, and it's really irritating. I know, but thank goodness. But please do your part and think about the next big thing, because honestly, this Congress, I'm not really sure that they're going to have the capacity to do the next big thing, but the next Congress might. So be ready for when that happens so you can hit the ground running, because you only have 2 years on the House side to do that.
Okay, last question. You guys did so well. You answered everybody's questions. All right, let's see. So just closing out this session, thank you all for joining us, and join me in a last round of applause for our guest speakers.